Hello everyone, welcome back. Doctors of Reddit. What was the worst thing you've seen for a patient that another doctor overlooked? Story 1. Rattlesnake bite. On a 2-year-old. Patient and dad out in the fields near a small town that is several hours away from the nearest big city, where I work. Dad takes the child to the ER in the small town with an obvious snake bite. The doctor there says, it's okay, she probably didn't get envenomated. He doesn't give the patient antivenin, which they had at that hospital, and instead of electing to send the child to us by helicopter, he sent her by ambulance. Several hours later, the patient shows up to our hospital coding and ended up passing. Probably didn't get envenomated? What the effing kind of dumbass idea is that? If a tiny child gets bitten by a rattlesnake, you assume they've been envenomated, and you treat them as though that had been. That means antivenin, physiological support, etc. Completely absurd. Story 2. I'm the patient, but it's an important story to tell. From the age of about 17, I started experiencing regular abdominal pain every day and terrible gut problems. I couldn't seem to eat much anymore. I had fluctuating diarrhea and constipation, and my menstruation became increasingly painful. Despite being incredibly small, less than 5 feet tall, I started losing an enormous amount of blood. You'd think any doctor worth her salt would recognize a gynecological problem. But my doctor, a woman, by the way, at the time insisted it was anxiety. She told me she wouldn't bother testing for or treating a gynecological problem unless I was older and having trouble conceiving. Over the next few years, my gut and uterine symptoms slowly deteriorated. I was bounced around the system, seeing dozens of different specialists. I was told repeatedly, it's just stress, it's anxiety, are you pregnant? Are you sure you are not pregnant? As if that were the only explanation. I was told every woman has painful periods. I was prescribed over-the-counter laxatives for constipation and dismissed. Meanwhile, my gut function continued to grind to a halt. A functional gut test revealed it took 6 hours to pass an egg sandwich, when it should have taken just 90 minutes. I weighed only 40 kilograms. It got so bad I started losing bowel control. No treatment seemed to work. By age 24, I was unable to work because I was literally, uncontrollably, defecating on myself. Doctors suggested therapy, implying I might be exaggerating my symptoms. One day, I saw a new GP for some routine reproductive system health tests, and an abnormal pap smear flagged an issue. Within 2 weeks, I underwent an exploratory laparoscopy to rule out cervical cancer, only to discover I was absolutely riddled with endometriosis. It was everywhere, on my bowel, my cervix, my perineum, some ligaments, and even my gallbladder. There was an ovarian cyst the size of a tennis ball. With excisions and treatment, I regained gut function within 3 months. But it came at a steep cost. I will never be able to have children. If that doctor, when I was 17, had just done her damn job, I wouldn't have lost 7 years of my life, my gallbladder, my fertility, and my mental health. Story 3. During my residency, we had this lady in her 60s, who was getting progressively more forgetful, just overall declining, and getting less and less able to take care of herself. She had been seeing her PCP, who diagnosed her with dementia, and she saw a neurologist who agreed. She was not really able to provide an accurate history. After talking to her family and friends, it became apparent that her symptoms were progressing unusually quickly. I remember seeing the point where her new hair growth met her bright red dye, and also her grown-out nails with hot pink polish, thinking, wow. It really wasn't too long ago that she was not only taking care of herself but, going to get her hair and nails done. The lady in front of me was so far from that. The neurologist I was training with recognized this, had her admitted, and did every test, including a lumbar puncture. Workup eventually showed Creutzfeldt-Jakob disease, mad cow, for which there is, unfortunately, no treatment. She died a few months later, but at least we were able to prepare her family that she would only continue to decline, so they could make arrangements. Really sad situation. Story 4. A doctor put the pacemaker lead in the subclavian artery, and across the aortic valve into the left ventricle. The proper approach is, subclavian vein to right ventricle. And then, he didn't notice it for over a year. I saw the patient, a 25-year-old woman who didn't need the pacemaker in the first place, when she was in congestive heart failure because the pacemaker lead had destroyed the valve. A surgeon and I had to do surgery to remove the pacemaker and lead. Then, replace the aortic valve. Totally inexcusable. Well, 50% of doctors are below average, but everybody thinks theirs is in the top 10%. Story 5. When I was first diagnosed with a large brain tumor, the technicians wouldn't tell me anything. I came out of the MRI, and they all just looked really sad and uncomfortable. The neurologist met me before I went to the changing room and told me they had an ambulance waiting for me. They gave me a CD to give to the doctor at the emergency room. I spent like 2 full days convinced it was a bizarre prank because all the doctors were so vague with me. Story 6. I went to a dentist's office for several years, and was repeatedly told to get braces, and have my wisdom teeth removed. Both of these pose an issue, since I play trumpet for a living, and performing at a professional level is difficult, impossible with braces. Furthermore, having wisdom teeth out would put me out of work for at least a month during recovery. The dentist told this repeatedly, during every visit. I decided to get a second opinion about the wisdom teeth, so I went to an oral surgeon to have them look at it. They took x-rays, and looked at the records from my dentist. Then the conversation. Oral surgeon: so, you're experiencing a lot of pain in your wisdom teeth, according to your record. Me: I am not. At all. I never have. Oral surgeon: so, I'm just going to assume your regular dentist falsified the rest of your record too, so I can put this folder down and do my job. He then went on to explain that the way my wisdom teeth came in, they're sitting on a nerve that's next to impossible not to cut in the process of removal, which would leave me without feeling in the lower half of my face for the rest of my life. As you might imagine, this would also be a major issue given my career. I was advised that if they're not in pain, not to worry about them. I do need to extract an adjacent tooth to one of my wisdom teeth, though, which my regular dentist completely blew off when I asked about it. I never went back to my regular dentist and will be starting with a new one soon. Story 7. I'm not a doctor, but a RN. When I was in college, I got to where I couldn't swallow. It started with difficulty swallowing, it progressed to me having to swallow bites of food multiple times, regurgitating it, and then it got to where all I could swallow was broths and mashed potatoes with no chunks. I went to the doctor multiple times and was told every time it was acid reflux and part of my anxiety disorder. I lost 30 pounds, I was only 120 when this started, and I was just generally miserable. Finally, my grandma was tired of watching me be sick all the time. So, she called the GI doctor herself. They said we needed a referral, but she explained the situation, and they got me in the next day. They did an endoscopy, and my esophagus was 95% occluded at the gastroesophageal sphincter. For some reason, some of my primary doctor's notes ended up in my discharge paperwork. I guess they had to contact her to get my information, and she had told them it was acid reflux, and basically, I was being overdramatic. She stated she did not recommend them to do the procedure. Needless to say, I switched doctors. Was not a fun year. Story 8. One time, I went to the doctor after passing out on a plane. The doctor listened to my chest with the stethoscope and said, "There's something." She told me to go urgently to the X-ray section of the clinic. It was 4:55, and they closed at 5 o'clock. She told me to tell them it was urgent. So, I went to the X-rays, and gave me an extra spot. I went at 5:05, and the radiologist was pissed off, because it was past his closing time, and I had told him that the doctor requested an urgent report. He was giving me the instructions all aggressively, and after taking the X-rays, he went to see the image. He immediately came back and gave a 180 degrees change in attitude. He called me sweetie and told me we needed a few more images. I immediately knew it was going to be pretty bad. Worst thing was that when I had the report to the doctor, she did not tell me anything. She just requested an appointment with the specialist and said she would forward the images to him. The appointment with the specialist was 1 month later. I had to wait for 1 month to know what was wrong. Story 9. One of my friends is a vet, originally from the UK, but practicing in Canada. She says she makes it a rule to be direct and straightforward about what the problem and diagnosis is. Like, don't just say, "We found some worrying lumps on your dog," say, "I'm very sorry, but your dog has cancer." Otherwise, how on earth are the owners going to be able to make decisions on treatment if they don't know what the issue is, or the animal's prognosis? Some people saw her as blunt, but it's much better to be clear, than vague and leave the owners thinking it's something recoverable when in the long run, it isn't. Story 10. I was 26 and found a lump in my breast. Planned Parenthood had taught me self-checks, and so I knew it felt different than a cyst. It felt exactly like the tumors I'd been taught to recognize. First doctor says, "You're too young for breast cancer." I didn't accept that and went to a second doctor where I got, "It hurts when I mash it, right?" No. "It gets bigger with your period, right?" No. "Sure it does." Third doctor, "You'll have an ugly scar if I biopsy it." Fourth doctor. I told him to call the police to get my naked, topless self off his table because I wasn't leaving without scheduling a biopsy. It turned out I had stage 2 cancer, and after surgery, 9 months of chemo, 3 months of radiation, and being told I couldn't have kids, I survived. I now have 3 kids, and I'm 62 years old. If you think the doctor is wrong, get a second, third, whatever opinion. Listen to your suspicions. Story 11. I had an MRI text demeanor do a 180, so I knew something was up, but they can't tell you anything. The doctor came in, said a bunch of crap I couldn't understand to some med students, left, and sent 2 students in to tell me I had a 5 centimeters mass in my brain. They couldn't tell me much about it, and I understandably freaked. I was told I would be called to schedule a surgery, and ended up in the ER of another hospital 2 weeks later. I spent a week in that hospital. I was transferred to another, had major brain surgery, went through recovery and rehab, and was home for a month before the other hospital called to schedule the surgery. The mass had started compressing my brainstem and cutting my voluntary functions by the time I went to the ER. Story 12. Not a doctor, but for years I've had migraines. They were mainly behind my eyes, but I chalked it up to stress and hormones. So did the neurologist I went to see for them. She seemed annoyed that I kept saying the pain is behind my eyes, in my temples, and the pressure was insane. She gave me Imitrex and sent me on my way. I went to visit my eye doctor for a checkup, and she did the exam and asked if I get headaches. I told her yes, but it seems like I always had one. She told me my optic nerves were very inflamed, and excess spinal fluid or a tumor can be the cause. She sent me to a neuro-ophthalmologist, where I had a brain MRI, a spinal tap, and new medication to help keep my spinal fluid in check. The neuro-ophthalmologist said I was about 6 months away from vision loss. That I was lucky I mentioned my headaches to my eye doctor. After the spinal tap, they took out about 100 ccs of fluid and measured the pressure at 42, when normal spinal pressure is 8 to 16. Big middle finger to the neuro who shoved meds at me. Story 13. MD here. Recently, I was called over by a nurse who told me a patient's bandages were wet, as they were bleeding a little. The patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point, the patient passed out. The patient was sent to theaters for an emergency operation. Close call, for sure. Story 14. Not a doctor, but when I was 16, I was studying to be a nurse, and I got sent on a shadowing/work experience to a nursing home. The worst thing I've seen overlooked is loneliness. There was a resident, I'll call him Mr. R. I had a little free time on my second day, so I went exploring to try and learn the lay of the land. On my walk, I glanced into one of the rooms, which had their door open, and saw the resident inside, coughing and spitting up phlegm on his own shirt because he had nothing else to cough into. I ran and got him a box of tissues. While he's wiping himself down, I sit opposite him, waiting in case he needed anything else of me. He sees I'm new. He thanked me for the tissues, and we began talking about the pictures in his room. He told me his life story, about his time in the army, how he met his wife, about how he missed traveling to Sweden every year, all the dogs he'd had throughout his life. He was the first person to talk to me in a friendly manner at the placement, and I really enjoyed chatting with him. He was funny, smart, and overall just a nice person. He had lived a long and interesting life, and since he had no children, it had been a while since he had spoken to a teenager. After about 20 minutes, a member of staff knocked on the door and told me I was needed. I said goodbye to Mr. R and promised to visit him again during my stay. I thanked him for making me feel so welcome, and he thanked me, and began to cry. He said no one had ever done that for him. Mr. R had been at the home for 3 years. In all that time, no one had just sat down and talked to him, asked him questions, and genuinely listened to him, made him laugh, made him feel heard. I ended up making several formal complaints and inquiries about multiple problems I witnessed and encountered. Manhandling, neglect, unclean environments, belittling language towards residents, and a general lack of care was just a few. It was the first time I had ever been both so heartbroken and angry. As a caregiver, one of the fundamentals is that you have to care, and for one reason or another, those staff had forgotten. There were a lot of things I saw at that placement that I will remember for the rest of my life, but the hanging feeling of isolation was the worst. Story 15. A guy came into our ICU and was very septic, but still talking. He had visited his primary care MD with complaints of a sore throat for a couple of days. Dismissed without any intervention, since he didn't appear to have strep throat or the flu. At this point, he was having pretty severe abdominal discomfort, so we sent him for a CT scan. As the scan was finishing, he coded and had to be intubated, multi-organ failure, etc. The CT scan was horrible, he had all kinds of garbage all over his peritoneal cavity. His wife told us that he had choked on an ice cube the day before he saw his primary care MD. Evidently, he swallowed a whole, double half-moon-shaped ice cube that perforated his esophagus with a huge linear 4.25-inch tear, allowing a significant portion of his swallowed food and drinks to get into his peritoneal cavity instead of his stomach. To make things worse, he had some reflux that allowed stomach acid to get in there as well, likely while he was sleeping. Once we realized what was going on, he went for extensive washout and exploratory surgeries to repair the damage to his esophagus and other organs. Thankfully, he made a full recovery, but he was very close to not making it. Story 16. A woman came into the ED for extreme fatigue and spontaneous bruising. They checked labs and saw low white blood cells, red cells, and platelets. They told her she has leukemia and will need chemo, without actually doing any confirmatory tests. They admitted her to my service. She is crying and screaming in fear. I get more history and find out she was just started on a medication for her rheumatoid arthritis that can cause decreased blood and platelet cell counts as a side effect. Did some further workup and found no evidence of leukemia, stopped the new medication, and within a week she was completely back to normal. Story 17. Once, when I was a medical student on surgery rotation, in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently, he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. So, as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we CT scanned his abdomen and saw his common bile duct was like 3 times normal size, could drive a truck through it. About that time, the next set of vitals showed his temp was 103 degrees Fahrenheit. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. Story 18. Probably the worst story one can hear. My wife found a lump under her breast that was really concerning. It took her about 2 months to get a proper appointment to have it looked at. The doctor diagnosed it as a cyst and fibroadenoma. She drained the lump, and it was fine. It grew back a week later and was bigger. Finally, after being in pain for weeks on end, the doctor said, "This is clearly not working, so we will do surgery and remove it." Upon going in for the checkup, thinking they'd take a look at the scar and healing, it turns out that she had stage 2A triple-negative breast cancer. The surgeon was absolutely floored. The most upsetting thing was that, while her main surgeon/gyno, who was fantastic, was on holiday, another male doctor told her, any surgery would be merely cosmetic, and it clearly didn't bother her because he could touch the lump. I almost laid that doctor out in the office. When she got the diagnosis, he apologized to both of us for being an a-hole. Unfortunately, this story didn't end well. Despite doing 8 months of therapy, chemo and radio, her cancer returned 7 months later and ultimately led to her passing after it spread to her brain and spinal fluid. So many people told me, breast cancer. That's one of the easy ones. My insert relative nobody effing cares about here had it. She switched gynos twice because they wouldn't take it seriously. It's been 6 months now, and not a day goes by where I wish I could have taken her cancer away. She was effing 27 years old. Edit, to everyone wondering how I am doing. It's been 6 months since she passed. Though I have been grieving for a while longer, anticipatory grief, they call it, and so, considering everything, I am doing well. It was her birthday on February 28th, and she would have been 28. So, the week was quite solemn, but other than that, I have found ways to move forward with her, not from her. Whenever I have a moment, I let it happen, and then I continue. I do have PTSD from her time in the hospital, but I am learning to deal with it, and when COVID calms down, I will go to therapy. All in all, I am doing well, enjoying life as much as COVID allows, and just processing all my feelings. I miss her every day, and I will for the rest of my life. Story 19. In my psychiatry residency, I was working in the psych ER one night when we got a transfer from the main ER. Her family had brought her in for altered mental status, which had been getting gradually worse over the past 2 weeks. She had been cleared by the ER doctors, all labs and vitals had been normal, and I was told she was likely having a mental breakdown or psychotic episode. She was rolled into our area, and I went to assess her. She was non-responsive, staring off into space, crying and shaking her head back and forth, and mumbling. She could not answer any questions and seemed to be having a tremendous amount of anxiety. As a psychiatrist, one of the biggest lessons my mentors taught us was to assume a change in mental status is always a medical condition until proven otherwise, then you can think about psychiatric causes. Within a couple of seconds of me seeing her, I had a gut feeling this was not psychiatric in nature. I looked through her chart and saw she had a history of blood clots in the past. Her vitals were rechecked, and again, they were totally normal. At that point, I made an executive decision and ordered a stat CT of her chest, looking for a possible clot. The technicians who came to take her for the study were slightly confused as to why a psych resident was ordering this. The radiology team, even, called me and wanted to make sure I had not ordered it by mistake. 30 minutes later, I get a call from the on-call radiology resident, and she says, "Are you the psych resident that ordered this CT?" "Yep, that's me." Thinking I was about to get some comment about wasting their time, she continued, "And this patient is in the psych ER?" "Yes." "Well, you better call the ER and have her transferred stat, 'cause this lady has the most massive pulmonary embolism I have ever seen, and will likely code any second." So, with that, we transferred her back to the ER. She was admitted to the hospital and treated for her clot. Within a few days, she was back to normal. From then on, whenever someone would make a joke about a psychiatrist not being real doctors, I would tell them this story, and that would settle it. Story 20. My foot doctor had a patient who had foot pain, so they took a look and found that the bone was infected. They sent a biopsy in, and it came back as lung cancer. Turns out, the patient was being treated by the PCP for bronchitis for 2 years. This was an older woman. If it hadn't spread to that old injury in her foot and she hadn't seen the podiatrist, who knows how long it would have taken to get diagnosed. He said he doesn't know what happened after that, because he immediately sent her to the appropriate doctors. Story 21, not a doctor but the patient. When I was born, I was my dad's third child, 2 from a previous marriage. He knew something was wrong with me because of the way I was breathing, very rapid, short breaths. When I was 3 months old, they noticed there really wasn't a change. The first hospital he and my mom took me to said that there was nothing to worry about and babies just breathe like that. He was 100% certain they were wrong. They took me to a second hospital, and they said there's definitely something wrong. But they didn't have the technology to help. 1986. They recommended us to a third hospital, which was a couple hours away. Finally, the third hospital took me right in and performed surgery that day. Turns out I had 5 holes in my heart. They tried to go through my rib cage, but it didn't work. They had to crack my sternum and go directly through my chest. They took my heart out of its body and patched the holes. I'm doing wonderfully medically today, and am forever in their debt, not financially. Story 22. I was a few days old, and my parents' first and only child. My mum saw me turning bright red and blue around the lips when I cried. Mum demanded the pediatrician, to which a nurse told her, "Oh, Mrs. Sailwayer-Ian, this is your first child, and you wouldn't know." She replied, "I teach child development at the tertiary level, and this is not normal." Got the pediatrician in, and boom. I have tetralogy of Fallot. Story 23. Also not a doctor, but the patient. I go to the ER after 5 days of strong abdominal pain. That was my fault. If abdominal pain lasts more than 24 hours, go to a doctor. The ER doctor runs some tests and comes back with a diagnosis, hepatitis. I look at him, and say, "Nope. You're wrong. I have been immunized against Hep A, and don't engage in any behaviors that would result in Hep B or C." He goes back and they run other tests. Turned out my appendix had burst. Story 24. 20-odd years ago now, my gran went to the doctor for shoulder pain and died in hospital. Turns out she had cancer, but they couldn't even tell where it had started, because it had metastasized to a bunch of other places by the time they found it. We assume lung cancer, because she was a heavy smoker, but in the last 3 years, I've also lost smokers in my family to ear cancer, stomach cancer, gallbladder cancer, and my uncle has just been diagnosed with bladder cancer. Story 25. I was working nights, and a patient came in for a nailed repair under general anesthesia. It was a slow night. As they're anesthetizing him, he aspirates, so we do a chest x-ray to see if he's got any spit or blood in his lungs. What we didn't know is that, prior to this emergency surgery, he'd been going to his GP for over 6 months, complaining about chest tightness. They'd put him on various different asthma medications, but none had any effect on him. The x-ray showed a massive dark mass in his left lung. We kept him asleep and transferred him to ICU. His wife and 3-year-old daughter were waiting for him on the ward. We had to tell them where he'd gone, why he'd gone there, and what was going to happen. He died from lung cancer within a month. Edit: a general anesthetic is absolutely ridiculous for a nailed repair, but he refused to have it done under local. A commenter below rightfully corrected me, and after talking with a colleague, the dark space in his lungs was the normal lung, and the rest was whited out because they were riddled with tumors. This man was in his late 20s, a non-smoker, and I couldn't move past the situation for months after it. Story 26. I work in EMS. We got a call for a female with leg pain. When we arrived on scene, this woman's leg was 3 times the size of her other one, blue and purple, and she had no pulse in her foot. She had fallen on ice a few days prior, and the urgent care didn't do any x-rays, telling her she had a sprain and giving her a walking boot. In reality, her tibia and fibula were both so badly fractured that they were cutting the blood vessels and muscle tissue. She lost her foot. Story 27. AIDS. As in, the patient had no working white cells whatsoever. It all started with what appeared to be a fungal infection in the chest. However, after many pulses with itraconazole, the plaque was still present and growing. So, the physician called me to check the patient, and the chest plaque was indeed very suggestive of a fungal infection. The direct examination even confirmed the existence of the fungus. However, the treatments were doing nothing. So, I rechecked the file, and lo and behold, the leukocytes count was quite low. A quick HIV test later, and the patient was diagnosed with AIDS, on top of its body fungus. To the credit of the physician that called me, the patient lied on the clinical exam, as he marked he had no active sex life, but, when confronted with the evidence, he spilled the beans. Turns out he was a regular with the local hookers, but also quite active in online dating. Public health wasn't happy, to say the least. Story 28, I'm not a doctor. I'm a nurse, but not in med surgery. My sister had her gallbladder out, routine surgery, and 2 days later, woke up at 4 a.m. in searing pain. She went to the ER by ambulance. I met her there. The ER doctors were all apparently convinced she was a drug seeker and did not even conduct a physical exam beyond taking her vitals. They snowed her to shut her up because she was just yelling, "Help me! Help me! I'm dying." They did eventually do an MRI, but said it was negative and sent her home. She didn't want to leave, insisted something was terribly wrong. But they said they would call security and have her thrown out. At this point, I'd like to mention that she had no history of drug or alcohol abuse. She continued to get worse at home, and the next day went to a different hospital. They did a workup and found that the metal clip that closed off the bile duct had cut right through the tissue, and she had a large bile leak that was literally burning all her abdominal organs. She had to have 3 surgeries to fix it and was hospitalized for 9 days. Left with chronic pain from adhesions and chemical burns. When the new hospital finally acquired the MRI from the original ER visit, she was told that the leak was small but clearly visible in that image. Story 29. Medical student here. On my various clinical rotations, I was taught a myriad of ways to recognize symptoms and determine the severity of each. If a patient claims they are dying, over and over again, they most likely are, in fact, dying. I distinctly recall my rotation at a gastroenterology ward. A patient suffering from stage 4 colorectal cancer was transferred back to the regular ward from the MCU. He got treated for bleeding in the rectal cavity, however, due to the severity of the metastases, it was decided that, should another bleeding occur, he wouldn't be transferred to an MCU, ICU, or other unit. The patient was brought in, seemingly in high spirits. He was talking and cracking jokes with the nurses, and having good conversations with his family members that were with him. Then, he turns to his wife and says, "Honey, I feel I might be dying." Being a terminal cancer patient, he was indeed dying, but not even 15 minutes after he had said that, he began bleeding severely from his anus. It dripped through his garments, seeped through the bed and onto the floor. The nurses were trying their best to keep him clean, while we figured out what the hell we could do to help him. We could do nothing. The man essentially bled to death right in front of our very eyes, while continuously saying, "I am dying." Moral: there's a time and place for scrutiny, but if a patient claims they are dying, take it seriously. Story 30. I am a hospice nurse. I am absolutely certain that most patients who die of an acute event related to a chronic disease process know something is wrong before it even happens. I often explain terminal restlessness to families by telling them that it is the body knowing something is wrong but unsure of what to do about it. Unfortunately, most of the patients that experience terminal restlessness seem to be physically more healthy than the weaker patients that just kind of close their eyes and pass. This creates a lot of frustration for the family. It is probably the worst thing to witness as a nurse. And, short of complete sedation, not a lot truly seems to help it. Story 31. I'm a dental assistant, and a patient came in. His color was off. His jaw hurt, and a tooth. He'd just come from the doctor, who told him to see us. I was suspicious of a heart attack. I put the pulse oximeter on him and almost fainted myself, 82%. I grabbed our emergency high flow and yelled for the AED and 911. The guy was having a heart attack. The guy lived and brought me a big old heart-shaped box of chocolate at Valentine's. I've never been so scared or angry for another person. The dentist I worked for called the MD and said, "My 25-year-old assistant just saved your patient's life." Story 32. One that comes to mind is when I was a resident, the ED doctor wanted to admit a mild septic patient with a UTI. I reviewed her labs, and, knowing that she is a diabetic, it was obvious, florid DKA, diabetic ketoacidosis. That kind of admission typically goes straight to the ICU to get insulin via a drip and aggressive fluid rehydration. She was just in the ED hallway, with no medications at all, looking like crap. Story 33. I work in a nursing home, and I had been there for about 4 months at the time, no prior healthcare experience. Went into a resident's room. She was diabetic but I didn't know this at the time, and as I leaned in to speak to her, I smelt ketones on her breath. She was also pretty lethargic, and her lethargy had been noted by staff on an earlier shift. I was immediately worried. I called the nurse on duty to her room, who said, "She's just having a sleepy day." I explained I could smell ketones, and she laughed and said I didn't know what I was talking about, and headed back downstairs. I called an ambulance for that woman myself, and she was taken to OND and diagnosed with diabetic ketoacidosis. Poor woman was a few hours from death. That's it for now. See you in the next post.